When COVID first shut the country down for many Canadians, social options were extremely limited at home.
During the pandemic, I bought a lot more just because there wasn't much more to do.
I would say yes, because I got more time just to sit at home.
Working on our cottage and then chilling and having some people over.
Unless we were staying in the backyard going swimming, and you need more refreshments, right?
Dr. James McKillop is an addictions expert at McMaster University, and his study found that COVID-19 encouraged Canadians to stock up on substances.
For alcohol, we saw about 5.5% increase over that 16-month period. For cannabis, we saw an almost 25% increase.
The study found that Canadians spent $1.86 billion more on alcohol compared to pre-pandemic trends. $811 million more was spent on pot. It's noted that cannabis had just become legal right before the pandemic struck. Dr. Sanjeev Sokalingam from the Centers for Addiction and Mental Health says there's a multitude of reasons why Canadians turn to alcohol and cannabis.
Ongoing distress or anxiety that might have crept up during the pandemic. We know that even though things are reopening, people are still anxious about what this means and the uncertainty. We know that mental health effects often linger in these pandemics or these states, that they don't just go away, and so people are probably still struggling.
Despite the lifting of restrictions, for many, their habits haven't changed back to pre-pandemic routines.
Well, I think it's still the same, really. You're just kind of keeping that routine, right?
All that stuff keeps my anxiety low, because anxiety is really high right now because of all this pandemic.
Sort of a canary in the coal mine to the extent that we're seeing dramatic increases. And it may mean that we need more services available for people who are struggling with cannabis use following the pandemic.
Dr. Sokalingam offers some options.
How they can start to decrease or reduce the use, prevent using kind of more potent types of cannabis, for example, maybe using things with lower THC as a possibility, and moving from smoking to other forms of cannabis use.
Well, the study focused on legal drugs to help with tracking, but first responders across Canada have called out that the pandemic has been met with a huge surge in illegal opioid-related overdoses.